I do that all the time. Like if I'm deciding whether or not I want to, confront my wife on something, I have to do a risk analysis. And usually I say,
maybe that's the analogy we look at.
I'm not going to accept these risks. I'll keep my mouth shut.
You're listening to the Help Me With HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
Welcome to the helpmewithhipaa.com podcast episode 100. We made it.
100.
It's almost as old as Donna. Almost as old as Donna.
I should have been prepared for that.
I know. Wow.
We're gonna have to start doing like real scripts and rehearsals so that.
Yeah.
No, that would make it just fun.
The impromptu, yeah, people love it. So episode 100, we're gonna have some fun with this one. We've spent a lot of time thinking about it.
Yeah, 20 minutes.
Yeah, right before we press record. So, but before we dive into the topic today will be the top 10 HIPAA lessons. And don't be fooled, this will be fun. And also, stay tuned. We're going to tell you how you can pick up a $100 gift card since we're doing episode 100. So hang on to learn more about that. But first, we want to talk about the HIPAA Bootcamp because it's coming up quickly.
Yes, it is.
So May 11 and 12, 2017.
Yeah, we're getting a lot of random questions. So we're going to try to hit all of the questions here so we keep people informed. Clearly, we're not doing a good job of that.
It's your fault.
It's your fault.
So what are some of the questions you're getting? How to find out more? Is that one of them?
How to find out more.
All right. So we have two options. You can go to helpmewithhipaa.com/bootcamp, all one word, or you can go to thehipabootcamp.com. Either one take you to the same place. That's where all the information is.
Yeah.
Or you can
just email us like everybody else.
Hold on. I'll give you Donna's cell phone number. Let me find it. You can call. Oh, by the way, Donna, somebody said they're coming down and they want to know if there's enough room for me to slide over because you told them they could sleep in the same place with me. I was like, no, not going to happen.
Yeah, it's pretty funny, I thought. Yeah. Well, but we, if you need help with places to stay, we do have. There's Stone Mountain Park. There's a couple of places. There's hotels there, and it's a beautiful space. It does take a little while to get out of there because the speed limit is very low, and they do give tickets. Trust me.
And Donna has a nice fence. She's got a nice fenced-in backyard for your tent. You can
indeed we can do that. I can call up my friends and family. There's also a really nice country inn and suites not far from here, conveniently located. And then, of course, at the North Lake area in Tucker, also not far from here because we're in Tucker, there are Litany, Marriott Courtyard, a Doubletree, and all of those kind of things. So close by.
So for those of you who don't know, the HIPAA Bootcamp is going to be a live 2-day event that we are billing as the Ultimate Compliance Officer Training Event. So it's for compliance officers, regardless of whether you're a business associate or a covered entity. But we're taking basically what Donna has developed over the years into an 8 to 12-week course, and we're cramming that into 2 days. And we're turning the fire hose on you at full blast because a lot of people have come to you and have mentioned to me as well that they need help immediately. They don't want to take 8 weeks or 12 weeks. They really just want to get in there and get it done quickly and get moving on this. So
yeah, we'll see how that goes, right?
Yeah, well, I mean, they may be like, maybe we shouldn't ask for that.
Yeah. So it is May 11th and 12th. It is here in Tucker, Georgia at the Smoke Rise Country Club. Beautiful, secluded space. And we have a online form. You can sign up online. You go to the website, you click on it, you sign up, boom, it's all done. You pay us. We like that part. And we have people who are like, I can't be here those days. We are, we're really going to see how this goes, and then we'll take it from there on, what we do. We're considering having somebody film it and all of that kind of stuff, doing the video, but we don't know is the big answer.
Yep.
If we do, we will let you know, but we do know those 2 days we are doing this. So that part is the important part.
Yep.
And, sign up. Share
we'll
it
look
with
at the
your
left
friends.
coast.
Bring your friends and enjoy a nice weekend in Atlanta when we're done, because you'll be bug-eyed.
Very good. So any other things you got going on?
Oh, you got the speaker stuff. So May the 2nd in Hilton Head. What? I'm excited about that. I'm doing a whole cyber hygiene conversation. Wash your hands and your computer. No, don't do that. The boot camp, and then I'll be in June in Valdosta at South Georgia MGMA. July, the Atlanta Association of Legal Administrators has been so kind to invite me to speak there for their regular event. And I've also now have October, North Metro MGMA has said, please put us on your calendar. And in November, the Georgia Association of Orthopedic Executives.
Nice.
I know. And so we've got several different things that people are asking us about, and trying to work out dates on some other stuff too. So come by and see us.
And for you IT providers, I will be speaking at the Unconvention in Washington, D.C. in September.
Oh, yeah, I forgot. So you worked that out.
Yeah, for the most part. Still, got a little thing here and there to figure out. But yeah, be speaking
the Unconvention. I think that's
the Unconvention. Yeah, so it's going to be interesting. It's not your normal, stand up in front of people and talk. It's more of everything's kind of workshop-ish. So it's going to be interesting to see. When somebody says, you've got 45 minutes to do compliance, you're like, what?
Yeah, we're worried about doing it in 2 days. So
yeah.
There you go. All right, well, let's get to the fun stuff for today. What do you think?
Yeah. All right. So the top 10 lessons, or the top 10 HIPAA lessons, is what we're going to cover. So these are the things that we certainly hope that you have taken away from the other 99 episodes that you've listened to.
These are it's our goal to provide information about these things. We're hoping you get this.
Yeah. So, but before we do that, what are some of the top 10 ideas that did not make it into the list?
Well, we were looking at, do we do a bunch of top 10s, and that got thrown away because it was going to be too insane. And top 10 episodes, well, if those are top 10 episodes, most everybody's listened to them anyway. Top 10 things we have learned, which
we couldn't think of anything.
Well, we've learned a lot about things that I don't think we need to share with people. They're not going to be interested. Top 10 funny moments.
That'd be too hard to narrow down.
Well, and then a lot of those didn't make the air.
Yeah, they were funny, but we can't play them.
Yeah, and then top 10 stupid things we have said that did make the air, but then that seemed like it really wasn't going to be something you could value. So that's how I got to top 10 lessons that we're trying to share in doing our podcast. So this is about our podcast, the things that the different topics that we cover that we're trying to make sure you understand.
All right, very good. So as you have here in our notes, in the spirit of David Letterman, we will do a top 10, and starting with, drum roll please,
number 10,
basic cyber hygiene.
Yeah, that's a new term. I'm kind of in on, as you can tell, I've already mentioned it. But
yeah,
people get the fact of especially in flu season, keeping infections down and not letting things spread, and that's essentially what we need to do with our computers, right?
Mm-hmm. Yeah.
So all of the episodes where we talk about password management and antivirus and ransomware prevention and I don't know, David, what else? Patch management and
just all kinds of stuff.
Really,
firewalls.
That's what you got to offer. All
firewalls and UTMs and SIMs and lions, tigers, and bears.
So we do want you to understand basic cyber hygiene issues, and they are elements of HIPAA. But more importantly, these are things like we did just recently in our, is it time to start doing national cybersecurity training? And I know there are elements that are doing it. We've talked about it, but that is across the board. Anybody could listen to it and gain from doing it. So there you go.
Mm-hmm. And should be doing it regardless. Like you said, regardless of HIPAA, you should be doing this. Absolutely should be doing it. If you're not, it's just a matter of time before you have a catastrophe.
Well, and it's also one of those things, where they do the studies on how many people wash their hands.
Mm-hmm.
So I'm just saying, just know if you're not doing the cyber hygiene, people will be looking down on you the same way.
Yeah, and I don't have the statistics in front of me. I just sent them to you, I think, yesterday, but I think Pew Research did something on, they did a study of people based on what they thought about cybersecurity. Are you doing this and are you doing that? And all. Anyway, basically, even though I don't have the numbers in front of me, they basically said that people think they're doing a lot more than what they're actually doing when it comes to cybersecurity. So that's unfortunate because you can help people when they know they're not doing it right, but when they think they're doing it right.
And they don't want to listen.
Yeah, it's kind of hard to tell them, no, you're not doing this right. Yeah, I am.
Yeah, it was like 43% of the people got less than half.
Yeah,
of the little quiz right. So we all got 100 on ours.
Yeah, we did. We did too. Good job. Good job.
Thank you, David.
So,
Number 9.
Documentation. Because as we say here, if you don't document it, it didn't happen.
That's right. And if I ask you why you made a decision 5 years ago, gonna need to know it.
Yeah.
Because you got to know, you got to keep your documentation, your policies and procedures. And all. Really, it's the written stuff. It's the records that tell us what you did and why you did it. And, if we learn later that something we assumed was a low risk is really not a low risk, we need to know why we thought that and what piece of information we were missing, as well as, does anybody remember why we did this? It happens all the time. And yes, document that you're going to document and then have a meeting to document about the fact that you're going to document.
So you mean to tell me that I'm supposed to follow the documentation?
I know, really.
I thought it just, put it together and throw it in a drawer.
The templates, the policy and procedure templates, get those, put them in, you're done. You don't ever have to look at them. It's shocking when we have people pull their policy and procedures out and they didn't know what they said, so they're not following them. And we're like, see, this is why we don't do templates. So,
yeah.
Yes. So documentation of everything.
I had somebody recently tell me that we have a policy that says that we're going to reset our passwords every 60 days, but we don't really do it.
So like, why do you have it?
Okay. Maybe we need to have a discussion about that.
We have a policy that encourages us to do this, but we don't believe in it.
Yeah. We have a policy that says we can do what we want when we want. Anyway, so number 9 is documentation.
Number 8.
Encryption. Man, this is one of those things where it gets tossed around a lot. Do you encrypt? Do you not encrypt? How do you encrypt? Why do you encrypt?
Mm-hmm. Yeah. Who, how, what, why? Who, what, where?
Yeah.
When? Okay. There's a rule there that we learned in school. Clearly,
yeah.
It's vaguely
some
in
of us
my
did.
recollection.
Yeah. But the encryption piece, definitely, if you have especially mobile devices and laptops, phones, anything that accesses PHI, those things should absolutely be encrypted. We have seen, I can't tell you how many cases where somebody has lost or stolen a laptop out of a car, and I don't even understand that, how it's still such a huge problem, and it's not encrypted. And of course, that's where your problem starts. If it gets stolen or lost and you have some type of documented proof that it was encrypted, then you're going to be well off.
Yeah.
But if it's not encrypted, you're in some major trouble.
Yeah, I was in a meeting yesterday and we were reviewing, doing an annual review of a risk management plan with one of our clients, which is always fun. And in the discussion, this is the encryption plan and here's how we're implementing this and we're doing these things. And then we would say, well, we got this other problem over here and we got this other problem. And then finally it was like, if we encrypt everything, just everything, like 6 things would fall off this list. Oh, yeah. Yeah, it would. Well, let's just encrypt everything. Okay, now you're getting it. It's great.
Yeah.
So the more you encrypt, the less you have to do.
Well, we've had the argument, not us, but other people have had the argument for the longest time that, encryption is addressable. It's not required. Of course, people do forget that addressable doesn't mean that you don't have to do it. It means you still have to do it. You have to address how you're going to do it. So, and apparently that's obviously a problem that you and I are still addressing all the time about the addressable and required. And according to Devin at HIM 17, it's still an issue that the OCR has to address all the time.
Yeah. Addressable does not mean optional. Addressable means you can figure out your own answer. We're not going to tell you specifics.
Yeah, which most people want specifics.
I know. If you don't give me specifics, I'm not doing it.
Yeah. Either tell me what to do or I'm not doing anything.
There you go.
So,
Number 7.
news and guidance.
Yeah.
So that would be what we're here for. We provide the news and the guidance. Just listen to this podcast. You're good.
Well, we try to go over the news and get that information for you so that you're not having to read all those articles. You've got articles to read about your other 5 jobs you're doing or 15 jobs you're doing. So we're going to try to shortcut that. We're going to be your news curator, as well as when new guidance is released, whether it's actual guidance from OCR or, as we discussed last week, when they do a settlement or a resolution and they do the corrective action plans and all of those kind of things. Those are considered guidance as well, and the audits and all of those kind of things. So we're trying to offer that guidance to help you navigate some of the confusing things, as well as keep you up to date on the news so that you're able, when somebody says, why are we doing this? You can give them some horror story that you just heard about. And a lot of people do that, and there are things that we've had people say, this 4 things I've remembered from listening to your podcast, and all of them have helped me in a crisis or when I'm being questioned by management or all of those kind of things. So news and guidance, we're trying to I do the reading.
Look at him.
I read and review everything, and then David listens to it when you do.
Oh my gosh. No, you just didn't say that.
Just kidding. He does get to read it before you do.
Yeah.
Oh, he does.
Oh my God.
About 15 minutes. I don't know.
Yeah, I'm glad we don't have a video on this so you can see me shaking my head, face palming myself.
That's it. See, and this is why I can say those things, because he can't reach me.
Yeah, I know. So, yeah. And you would much rather listen to the news coming from me and Donna than reading this stuff anyway. Trust me.
I know.
We make it much more entertaining.
Some of it's legal documents. It's awesome.
Awesome. But let me give you a hint, though, too, listener. When you're listening to the episode and we cover something or say something that you find valuable, or you might have to use it later and pull it out of your little, bag of tricks, make a note of that somewhere, whether it's, on a piece of paper or whatever electronic note-keeping thing you use. That way, when it comes up and you need to talk about it again or show somebody information about it, you can just send them a link. Hey, you want to know why we need to do a risk analysis? Here's a link to some information about it from a podcast from, these 2 crazy characters over here that are talking about doing it. It's
create your own little thing in Evernote Web Clipper. That's the way I do those kind of things. I have a web clipper. Evernote Web Clipper is the most awesome way to keep that, because you can put little notes on your Evernote note and just clip the web page and put your notes on it. You can put tags on it so you can quickly find them, and you can always then go back and find that reference here you're looking for. So Evernote Web Clip, our web page clips.
Good grief. Yeah. All right.
Anyway.
So,
Number 6.
business associates.
Yeah, and I wanted to separate this into 2, but I wanted to make sure I also got news and guidance in there. So this is really 2 things crammed into one. When it comes to business associates, you have 2 elements you have to worry about. Number 1 is your business associate agreement, and that's what everybody thinks that business associates are all about. But you have to manage all of those business associates. And by management, I say keep up with the contracts, which contracts you have. Are they expiring? Do they have everything in it? Do you need to make changes? And vetting your business associates. We've talked about that so many times. The importance of particularly the high-risk ones. asking them specific information, or in the bigger ones, get their white papers, get their documentation that shows their security and their programs. They have this information available, but ask questions and vet these people. Don't just worry about your BAA and walk away.
Mm-hmm. So you mean to tell me when my IT provider says, yeah, we're compliant, that's my due diligence, right?
Yeah, I don't need to tell you how many times that went horribly awry when we go in and start asking questions. And you don't have to ask a lot of complicated questions. I mean, like I said, we got our own little questionnaire, and depending on how you answer it, that, it's how many questions. You might get as many as 50. You might get as, some people just quit at 3. So, but simple things like, do you have a business security officer, and does the security officer get special training? What kind of training do you give them? I mean, that simple things. Have you done a risk analysis? And if you get red flags with their answers, but it's very, very important to vet these people and do it annually, not just once. Mm-hmm. And people ask me why you want to do that. And it's because people change jobs. Mm-hmm. So the person that was doing it before may not be doing it now, as well as businesses change. And if the person that was doing it now has 15 other jobs, maybe they're not doing it as well as they were. It'll help them refocus. But it's good for your business associates to be questioned on a regular basis.
Mm-hmm. Put them in the hot seat.
Mm-hmm. Hot potato.
Yep. All right. So for those of you who may have skipped the beginning of the podcast, this is episode 100. And we are going to share with you in just a little bit a way that you can win a $100 gift card. So make sure you follow us to the end of this one.
Oh, we're going to wait till the end to tell them?
That brings us, I'm going to yell, yeah. You got to wait to the end. Don't be skipping either, because I'll know if you press fast forward.
Yeah, but we're going to do a drawing for a $100 Amazon gift card. And there's multiple ways that you can get your name in the drawing multiple times. So more time you're in there, and you can't win if you don't play.
That's what they say in the scratch-out counter.
Number 5.
Wow. This one's one we love. Number 5, professional HIPAA IT support.
It's very, very important. And not just because that's what we do. I mean, granted, we would feel that way because it's what we do. But more importantly is, I don't know how people do this without it. Either on staff or with a outsource, because this is, you don't just know it. You don't understand how to properly configure a firewall using a few clicks, or you do it at your house. It's not the same. And understanding data loss prevention and what options you have, and who is a business associate when you're doing your IT stuff and who isn't. And granted, there are some, we're HIPAA certified people that you might want to, yeah.
Oh gosh.
So that's why we say professional HIPAA IT support. Not just, we got HIPAA and there's nothing to it. If they say there's nothing to it, warning bells go off.
Yeah. I can tell you exactly what they're doing. They're taking the 8-page security rule and then calling themselves HIPAA compliant. And it's not.
Well, and they're not even looking at all of
about.
that. They're not worrying about the business associate agreements. They're not worrying about the documentation. They're not worrying about understanding minimum uses and disclosures and audits and all those kind of things. None of it. Unless they're saying you've got to spend top dollar for everything, which then is not the same either. So, but assuming that you can have what we call break fix, and go ahead and say what break fix is, David.
You break it, we fix it. Just call us when you need us.
That is not how you do proper IT security. So, and it was interesting recently. I was doing some training with a client, and because we were talking about specific IT things, the IT provider, the owner of the company, was there, and at the end he was saying, there's so many things in there that are just so simple and obvious to me, and I'm looking around the room and it was news to them, and we forget that. So it goes both ways that the IT people need to understand you're there to take care of these things, but not to assume everybody understands them. So there you go.
Mm-hmm. And don't hand your policy and procedure writing off to your IT vendor. I'm seeing that a lot.
Now, there's some of them, you can go and say, look, I have people put like in their policy for patch management, for example. We're going to do a policy and we're going to make sure this is happening. And then the procedure is co-written or managed with the IT people.
Mm-hmm.
You can't do it.
Yeah. No, I agree with that.
Thank you.
I know that's important to you, so I do agree with you.
But be leery of anybody that's HIPAA certified. Ask them by who. Was it themselves? HIPAA compliant. Ask them how. I teach people if somebody asks us if we're HIPAA compliant, do you say yes, David?
Do I say that I'm HIPAA compliant? I say that my business is HIPAA compliant, and it's something we have to do every single minute of the day to stay that way.
You can't just a stamp on it. I have a hard time saying, "Are you HIPAA compliant?" That's
today.
A trick question. Yeah, today I might be. That's a good answer. Today I might be. Yeah, that's a way to do it.
Yeah,
I might be today, but I can't tell you about tomorrow or yesterday, for that matter, right now. So there you go.
Yeah.
All right, let's get to the top 4 because everybody's waiting. I know they want to hear the number 1. It's nothing about the $100 gift card.
Another one that's near dear to our heart: training. Number 4 is training. Never enough training.
Train.
This is the thing about training is that it's one of the least expensive ways that you can make the biggest bang for compliance and keeping yourself, away from ransomware and all those bad things about it. It's just training your people. But it's also the thing that people want to do once a year for 1 hour or maybe even half a day, and they just kind of throw it away. And we've talked about this before, but there's no way you can create a culture of compliance or a culture of anything else in your organization if you're just going to do it once a year or once in a while. It has to be something you're doing over and over and over again. And training is where that happens.
Yeah, and training doesn't just mean sitting in a class. And it means in your staff meetings, have a conversation. Hey, did anybody see this story? Or has everybody checked, X, Y, and Z? Have a conversation about security in any kind of setting, and it's essentially training for people to remember to look at those things and think about those things. Use
teachable moments.
That's right. It's a teachable moment. That's what we do often, right?
Yeah.
But the other important thing is, it's a tricky thing, the training at work, because they look at you, do surveys of people about job satisfaction, and like one of their number 1 things is not enough training. And then you do a survey about what you hate about your job, and it's, I hate all the meetings. And often people see training as meetings. So how do you, it's just like everything else. People are crazy. So, it's like whatever you're asking me about right now, that's the most important thing. But if you can find training that engages people, that is a key component, because then that's not just a meeting, it's learning. And those are important things. But
I think people approach training sometimes with it's either too much or too long. We're going to do a half day or a whole day training. I mean, I would go crazy myself. Or they come in and go, okay, we're going to do a 15-minute training, and they don't have really any information to give somebody that's going to even hold their attention for 15 minutes. And so it's
just tell me what the law says.
Yeah, it's just not done well. And even some of the training programs that we see sold in the market just aren't done well. So you just have to find out what really works for you. But, going back to what Donna says a lot, which is it's the people. That's what training's all about. It's addressing the people, because that's where your greatest assets are, but it's also where your greatest point of failure is as well. It's people.
Securing the human is the most challenging part of any kind of security. They are the weakest link, and they always will be, because we react based on emotion and understanding and all of those kind of things. We don't just take information, store it, and use a logical path like the computers and the systems do. So it's always going to be an issue, but that's not a bad thing. It just means you address it properly.
Mm-hmm. And in case you've never heard me say this, the best free training that you can get is what you're listening to right now.
There you go. And if you don't like it, we'll give you double your money back.
Absolutely. We will. So that brings us to our top 3. I know.
Now we need better sound effects, Bo.
I know. Our audio editor's got to kick it up a notch here.
Dun, 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 dun.
So, number 3, risk management plan. Oh, man. And I have to put in here also, that's regularly reviewed and updated. It can't just be a one-time thing.
Yeah, every time we do a risk analysis, we lay out a plan, and it's a 10-year plan. Not so much what you're talking about doing. No. It's like what I was just talking about with the encryption thing. We're doing an annual review of what the plan is and the things that are in the plan and how we're doing on them, and we're doing smaller reviews and quarterly reviews and all this kind of stuff, making sure that we don't need to change the plan, that things on the plan are moving, because if you don't have one, that just means I'm not going to, it's haphazard and we know what happens then.
Mm-hmm.
Nothing.
Right.
Or the wrong things.
We have a plan. We just don't look at it. Until something goes wrong, then, they're trying to find the person that actually wrote the plan because they're not there anymore.
Well, it's like those cases where we go in and we say, have you had one? And they're, oh, yeah. And they bring you the binder and you open it up and it says, they're going to do a risk analysis on such and such date. And I was like, I thought you said this was your risk analysis. It is.
It's our pre-risk analysis.
Yeah, we're doing a loop here. The risk analysis says we're doing a risk analysis. It was their number one thing they needed to do. I'm like, okay, there you go.
Yeah. So risk management plan, that's actually step 2 of compliance, which brings us to the number 2, which is step 1. Man, I got everybody confused now.
I know, you're in a loop now.
Number 2.
Risk analysis. This is the first step to compliance, is you have to analyze the risk of what you're dealing with before you can go on to the risk management plan that we just talked about. So let's talk a little bit about risk analysis.
Yeah, because I'm getting more and more questions about risk analysis because everybody throws that term around, but what is it really? Mm-hmm. And it's important that you identify where all your stuff is that you want to protect, and then think of all the things that could go wrong with it, and then you evaluate how you're going to address those things. So, I've been trying, and I say you do a big risk analysis, and then you do a bunch of mini risk analysis. So one of the things I was kind of playing around with, and we're going to see if it works right now, is, most people have insurance, right? So you have insurance on your house, or if you're a renter, some people do renter's insurance, and you kind of should, but I understand when you don't. But if you own a home, you have insurance. You have a business, you have insurance. If you have a car, you have insurance. You have health insurance, we hope. And so all of those things, why do you get insurance?
To cover the cost of things when things go wrong.
Yeah. So if I don't insure my home, then I know if something goes wrong at my house, if I'm hit by a tornado or a tree falls on the house or there's a fire, I don't have a backup plan to recover from that, right? Same thing with my car. If I wreck my car and I don't have insurance, there's issues there. So deciding to have insurance means I'm looking at, here's the valuable thing I want to protect, and I'm looking at all of the things that can happen to it that would make me lose control or make it not be structurally sound, or it's just freaking gone, or it doesn't work anymore. You can't live in it. You can't drive it, whatever it is. If I'm going to suffer a loss of that very important thing, I evaluate it, and then I look at what are my insurance options and what do they cost. So, Like some people, when it comes to healthcare, I can't afford anything but what they call major medical, which says I'm just going to suffer paying for it and accept the risk of things that could be less than big deal things like cancer or major surgery. I'll just accept that risk that I'm going to have to pay those costs.
Mm-hmm.
Or on my car, only if the state makes me do I have certain kind of coverage.
Right.
And my coverage is up to certain limits because that's what I can afford, and I'm willing to accept that risk. Now, not having insurance on my car, that's really risky. Most people have insurance on their car. You could be violating the law by not having insurance on your car, right?
Mm-hmm.
So all of those that you're doing, those are risk analysis. You're doing a risk analysis. You're evaluating the value of the item, and you're determining what things could go wrong, and then you're looking at how you can protect it and cover yourself from those losses.
Yeah, I do that all the time. Like if I'm deciding whether or not I want to, confront my wife on something, I have to do a risk analysis. And usually I say,
maybe that's the analogy we look at.
I'm not going to accept these risks. I'll keep my mouth shut.
Yeah, as a kid, we did that too, right? It's a risk analysis. Yeah, are my parents going to find out? Do I try to confess first or make up a story now? That's mitigation.
Yeah.
That's my risk management plan.
Yeah. Do I get permission or forgiveness? Which one do I want to go for?
You're just so wrong. But yeah, those are the kind of analogies that we do them all the time. All day, every day, we're doing a risk analysis. You know what I'm saying?
I know what you're saying.
So it's
we just need to get people to do it.
Concepts.
Yeah, they just need to do it in the practice.
Well, yeah, you do it in your business. No matter what your business is, you need to be doing that. You're evaluating what horrible things can happen, and then you evaluate the ways that you can stop them or at least reduce the impact of them. And then you decide what you can afford to do along those ways.
Sounds easy.
And then make a plan, which is your risk management plan.
Absolutely. Easy
right.
peasy.
Here
Number 1. Drum roll, please. The number 1 thing that we hope that you take away from this podcast, if nothing else, is that it's all about patient care.
Please.
It's our tagline. We say it every single episode. It's about patient care.
I even say it now when I'm speaking. Remember, this is about patient care. What things can happen to your patient's data is about your business and all those other things, but it's their data. And we've told enough horror stories about identity theft and the financial crises that it puts people in, and everybody worries about our cost of insurance and healthcare. And, when you look at $1 billion a year in just fraudulent claims, and the way they do that is they steal data.
Mm-hmm.
So, you're torturing people, including yourself.
Well, patient care, often people think that it starts in the exam room, and it doesn't. Patient care starts from the moment they give you any data, they fill out a form sitting in your lobby. Patient care starts at that point, and patients expect that their providers or whoever they're giving their data to, they expect that data to be protected. The privacy and security of that information is expected to happen. And if you're not doing that, you're not taking care of your patients.
Well, there is so when you worry about branding and product awareness and all of that, which everybody started doing now, right? Is we've all started understanding that consumers actually get to decide where they go to a doctor or what business they use, and businesses make those decisions. So people are becoming more aware that they have to do branding and those kind of things, right? So, and in that realm, when I just spoke at SOAP, the conference in Orlando, the Southern Oncology Southern Organization, Oncology Association Practices. Thank God you were here. They had another speaker there, Kay Dozier, who, shout out to Kay. We had a great time hanging out together. It was a company called Socially Present, and she was talking about the brand and the importance of your brand, and that it starts from the minute a patient gets an appointment with you or they do research about you and they learn about you. They're wondering how they're going to be cared for. And when you have studies that show things like 50% of the people in at least a survey they did, say that they would consider another provider if their data isn't protected, if they think they're not going to be secured. And, we have to worry about protecting the patients so that we can avoid what I've talked about this for over a year. I'm concerned, since the Anthem breach, I really started talking about it. I'm concerned that we will reach a point where we have a crisis of trust in healthcare.
Yeah.
So it's about patient care. And David.
What? I'm holding.
Hold on to your hat. I am going to give you credit because you came up with that tagline and I thought it was great.
Thank you very much. Just doing my part.
Hey, so, folks, you see, I have to pat him on the head. See how well that went? Look, he just like, okay.
My little foot's just tapping.
So there are our top 10 things. And interestingly enough, we're probably going to talk about all those at the boot camp. Every bit of those, we'll cover a lot of that in the boot camp. So it won't be the same way. It'll be a little different, and it'll be one-on-one. And we'll also have labs so that we can visit with you. And hopefully we'll get work done.
Yes. Now.
All right. So now, should we talk about the $100 Amazon gift card drawing?
Heck yeah, because I want to know how I get my name in the pot.
Okay. First of all, let me say, it's just us, so we don't have the KPMG auditors and all of that kind of stuff. But, we will be able to prove that we are doing this honestly, and it will be a random drawing. And those of you who are my friends and family, you can't do this. You know who you are, and we're small enough that I'm going to know if you try to. No. That includes you, David. You cannot win.
I am not your friend nor your family.
Nor can David or his friends and family. Off you go.
They don't listen anyway.
Okay. I forgot about that. All right. Have at it now. Let's hit it. You want to cover how to get the entries in? Because you got a way you can get one. You have multiple ways you can get one entry in, and you can do all of these. So you get one entry for a list of things. You can get 2 entries for some other things. And then there's a way to get 3 entries.
Nice. It might even give you 4 if you do something crazy.
Yeah. If you can come up with a way and ask us for 4, we will consider it.
Yeah. So here's your way to get 1 entry into the drawing for the $100 Amazon gift card. You can do a review or recommend us online and send us a screenshot. It can be iTunes, Stitcher, LinkedIn, Facebook. We don't care where you do it at. Do a review, recommendation online. Send us a screenshot that you did it so we can see that.
Yeah. And for each one you do, we'll give you 1 entry. So if you did 3 of them, we'll give you 1 entry for each one of those.
Cool.
Yeah.
All right. So another way to get 1 entry, you can send in a question to us. You can do it by email, social media, SpeakPipe, which is on our website. Doesn't matter, but just send us a question that we can use on the episode. That'll give you another entry, 1 entry. Do a shout out to us on social media, Twitter, Facebook, LinkedIn, whatever. Do a shout out to us. Hashtag us or link to us, something like that. That'll get you
at Help Me With HIPAA.
At Help Me With HIPAA.
That's right. That's how you find us.
So do that. That'll get you 1. Now let's look at getting 2 entries. So double your money here. If you complete the listener survey and add in the notes, give me $100 and your email, then
we will give you give me $100 in your email. You say, give me $100, but you have to put it's an anonymous survey. But if you put in the notes, give me $100 and then include your email address. Sorry, I didn't say that right.
Yeah, you did.
My bad. In my notes.
So, yeah, this kind of sounds like my kids. Give me $100. Sure, whatever. All right. So do a listener survey And those are splattered all over the website, so you can do those. So go to our website.
HelpMeWithHIPAA.com/survey.
There you go. Easy peasy.
Mm-hmm.
Another way you can get 2 entries, send us an email. This is going to be funny. Okay. So send us an email that we joked about sending at the end of one of the episodes about me. Okay. So you'd have to have listened to that episode to know what we're talking about. But there is an episode out there that we talked about sending in an email about me. So if you know what that is and you just send us that email that we joked about, then we'll also give you 2 entries.
Mm-hmm.
And then lastly,
dun, 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 dun. Drum roll, please.
If you want to get 3 entries, very simple. Sign up for the boot camp.
You get 3 entries when you sign up for the boot camp.
Just sign up. Even if you don't come, just sign up and pay the money. And we'll give you 3 entries because that's worth $100. So do that. And again, if you can do something even crazier than all these and send us your reason as why we should give you 4 entries for it, we will consider it. I want to see what you can come up with.
Well, no, I'm very interested in that. What's worth 4 entries? We've told you what's worth 1, 2, and 3.
All right. If we see it on a major news channel, we'll give you 4 entries.
You're just wrong in so many ways. And then in others, you're right. That's probably what we do. So that covers our ways that you can get an entry, and we will be managing it, and we have it all internally managed. Carla will probably manage it because if she does anything remotely wrong, her halo hits her in her head. And but we plan to do the drawing on the Friday, May the 12th. At the boot camp.
At the boot camp. Yeah.
We're going to do the drawing. And then within the next couple of weeks, we'll post it out on social media and all of that. When we do it, it'll just take us a while to record an episode where we can tell you the details. So follow us on social media to keep up with those things.
Or just be at the boot camp. You'll know.
Yeah.
You'll be the first to know.
Yeah. You might even get to actually pull the name from the hat at the boot camp. So
how about that?
Never know.
You assume we'll have a hat.
I know, really. It could just be, I don't know, a box.
Because how many entries we get? Might be a shot glass.
That's it, David. There you go. Shot glass, Publix bag.
Yeah, no kidding. No telling. All right. So that's our show for today, the 100th episode. We thank you for listening. We hope you enjoyed it and got lots of value out of it. And don't forget to review us on iTunes, share us out on social media, all those other things that we've asked about. And plus, we'll give you some points for it now if you do it.
There you go.
Put you in for the drawing. So don't miss out on that. That's an easy way to make $100. I'm sure some of you have probably done things a lot harder to make 100. Maybe even a lot easier to make 100. I don't know. But you can visit us on the website, helpmewithhipaa.com. Don't forget the boot camp is at helpmewithhipaa.com/bootcamp. And you can also find it at thehipabootcamp.com. Both of them take you to the same place. So anyway, remember that HIPAA is not about compliance. And as we said, the number one thing that we hope you learn is that it is about patient care.
You've been listening to the Help Me With HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.